Welcome everybody. Today we're back into the category called the pain series. We're going to talk about the four major categories of pain today. I am Dr. Kevin.
Hey, I'm Coach Sean.
And we're the FitHealth pros. So pain can most often fall into one or more of these four categories. So we have nociceptive, inflammatory, neuropathic, and functional type pains. The biggest thing with having the knowledge of what these types of pain are and how they're defined and what you can do with that is that it helps you and your provider diagnose the type of pain. With that diagnosis, then it helps with providing the proper treatments and recommendations for you or your family members to take care of that. So let's get into it. Let's go ahead and start with number one.
Jumping with number one. Number one is nociceptive pain. Nociceptive pain is caused by an injury to body tissues. Now, most pain that you're going to suffer is going to be nociceptive. It's stimulation of pain receptors at the site of the injury. These are nociceptors, located mostly in the skin and the internal organs. It can present itself as a cut or a bruise, a bone fracture, a crush injury, burn, post-surgery or tumors. The pain itself will kind of show up as an aching or a sharp pain or throbbing or dull or deep or cramping of the internal organs. So it can present itself in a variety of ways, and it's very specific to the type of injury that you sustain. It can be hard to pinpoint sometimes. Other times, like in a cut or a burn, you know exactly where the pain's coming from. At least I would hope.
Yes.
The therapies may vary and are specific to the pain location, the intensity of the pain, the type of injury again. So depending on the injury, that's the specialist you're going to see that can help you with that. Or just go straight to a trauma center.
Right.
Just kind of, they'll figure it out for you. In terms of self-care, again, depending on the injury, we'll go with the good old RICE type of treatment, which is rest, ice, compression, elevation. You can also throw heat in with that. Relaxation, light range of motion for some injuries, light exercise or stretching for some injuries. Again, it's very specific type of pain. In terms of overall healing of that pain, you may want to look nutritionally for this to help speed pain along. Vitamins, minerals, and or enzyme supplementation, again, injury specific.
Yes.
Boom, that's one.
All right, number two, inflammatory pain. Here's the definition. It's a perception of and effective response to a noxious stimuli occurring during an inflammatory or an immune response.
That's a mouthful.
Woo! Okay.
Well done, Dr. Fox.
Yes, I got it. So, an inflammatory response, that can be from a sensitivity, an allergic reaction, whether it's nutrition or an immune response, whether it's, if you have a disease or an infection. And so that inflammatory response then causes a stimuli that's going to give you a perception. So that's the inflammation, it irritates those nerve fibers, and that's where you're getting the pain. Very good.
Man, this guy's a pro.
So, why do we have this? Well, it's an important protective mechanism so your body can heal the right way. All right? Any type of these pains are kind of a red flag and a warning sign. Take them as a warning sign, and you don't want to mask them. Any type of pain your body's doing, that's a natural response. So then you have to figure out why. Why is that response there? So let's talk about the 5 classic symptoms of inflammatory response. So redness, heat, swelling, a pain or hypersensitivity, and then also a loss of function. So if you have joint pain, you're not going to be able to move your joints that well. Therapy, again, specific to whatever's causing that inflammation. So if it's an infection, an impingement, or other traumas, definitely treat that appropriately. Is that the word, appropriately?
Yes.
Yes, that's right.
It fits.
Yeah, that fits. Self-care, Inflammation, first thing, we have ice. After a few treatments of ice, you can periodically go back and forth with ice and heat, just not too much heat on the inflammatory side. You want to make sure that there's a contrast to get the blood flow circulating. Also, light range of motion exercises, again, slow movements of the joints and of the area. Some stretching, self-massage, relaxation, and if it is due from an infection, if you need to take antibiotics, that could be a course of treatment as well. So that's inflammatory pain.
Nice. Third up.
Number 3.
Neuropathic. Neuropathic. So neuropathic pain is caused by damage or disease affecting the somatosensory nervous system. In this neuropathic pain, there can be a dysesthesia or abnormal sensations from normally non-painful stimuli. So oftentimes that's how it presents itself, and that's what's going to help a professional diagnose what's going on. It may be continuous, or it could be episodic, coming up from time to time, but it will give an impaired quality of life. Oftentimes those with neuropathic pain, that impaired quality of life will affect, say, 7 to 8% of all adults dealing with neuropathic pain, 25% of all those dealing with diabetes, and up to 35% of those with HIV. The pain can be caused by a lesion, effectively for the nerves, or disease itself. You may feel a burning, an electric shock, a stabbing or a pulsing or a radiating pain. So it can be pretty heavy duty how it's presenting itself in the patient's body. Now, in dealing with this, they'll give you certain medications from time to time, antidepressants, anti-epileptics, kind of to take the level of the pain down. Now, you can also possibly relieve impingements, relieve some pressure on the nerves that are affected. Chiropractic helps with that. You can also utilize acupuncture, electrostimulation. If these are not bringing that pain level down, the neuropathic pain, sometimes you may have to go down the surgery road, utilizing an ablation or burning the site of the pain on the nerve, the lesion on the nerve, utilizing nerve blocks to just take that pain down as much as possible. Self-care in terms of neuropathic pain. Now this is interesting because we can also go nutritionally on this. You can focus on improving your glycemic control to lessen some of the intensity of the pain. You can also utilize meditation, relaxation techniques, certain enzymes supplementations as well can take that inflammation down.
Right. I'm going to add also, a lot of the medications have very severe side effects. So if you're finding that you're going down that medication road and you're having side effects and you don't want to do the surgeries, look into those alternative methods. I've seen cold laser work real well, pressure wave therapy work really well, and then those nutritional aspects, definitely get rid of the type of sugar, because most of this you're going to see with diabetics. So managing that blood sugar, adding some mobility and some motion, looking at the type of garments that you're wearing on the legs, all of those things are going to be important. So don't think it's a one shot to fix it. From an alternative standpoint, if you don't want to take those medications that give you a lot of side effects, you really want to look at those alternatives. But when it comes to alternatives, you have to do a lot of little things to build up that. Absolutely. So neuropathic. So that's good. A lot of people have that, so that's an important one. So number 4 major category of pain is going to be the functional type pain. So this one is again kind of broad, encompasses a lot of different types of pains that we see in my office. Someone who presents with pain, it's going to have no obvious organic origin per se. Now, the exact diagnosis from the organ system with predominant symptoms. So let me say that again. The exact diagnosis from the organ system with predominant symptoms. So the example would be musculoskeletal system would then have a diagnosis of fibromyalgia or a visceral pain in, say, irritable bowel syndrome. Okay, so hopefully I didn't go over your heads with that. So in chiropractic, we come from the standpoint, looking at physics, looking at physiology, is that the musculoskeletal system impinges upon or is controlled by the nervous system. So we have that neuromusculoskeletal system. Okay, you following me there? So within that, now you can kind of identify where is the functional deficit. So finding the cause of the problem.
Right.
Okay, so this is huge. More than 15% of the population worldwide. Still a huge number. That's 15% of the world's population has some sort of pain, and we're defining that as functional pain. And in my line of work, functional pain is addressed. It's easily addressed. As long as you find the cause, I mean, this for me that's kind of my bread and butter. So as long as you're addressing those areas of dysfunction, going back to the neuromusculoskeletal system, all of the nerves are going to go to every organ and tissue in your body, and then that can cause that functional pain. So, possible complex interplay of genetics and environmental influences. All right, so what's that mean? Well, genetics, which has been shown that we can overcome that. So that is not a prison sentence.
So it's a predisposition, but not necessarily an absolute.
Absolutely.
Nice.
Yes. So genetics was a huge thing when it comes to this, because that would be kind of an easy out for the medical profession. Oh, well, your genetics are this, so now you are going to have it. Well, that's not true. Again, you may be predisposed, but as long as we can recognize that, it can be changed. This is functional pain now. I'm talking functional pain. The environmental influences. Well, any stressor to the body can affect the neuromusculoskeletal system. So, and from an environmental standpoint, you have nutrition, you have environmental stressors, smoking, drinking, allergies, smog, electromagnetic frequencies. All of these things can play a part in a negative stressor to the body, which then can cause those deficiencies. So this functional pain can last longer than a year. So we do see the patients that come in, they're not the ones that just were throwing the football and hurt their arm. They're not the ones that just lifted something. These are the patients, or you or your family member, you recognize them, that they've been complaining of this pain over and over and over for a long time. And they may have tried, patches on the back, or they may have tried the latest medication or elixir, and it just keeps on going on and on. Well, there is a way to identify those problems. So what else do we have? Areas of pain intensity are tabulated on a scale of 0 to 3 for treatment. Now, this is going to be more focused on those systemic type of pains, like the IBS or the fibromyalgia. And remember, fibromyalgia, if you've heard this term, hopefully by now you have, it's a pseudo-diagnosis. And what that means is that when you look up a lot of these diagnoses, they're supposed to tell you what the problem is and where it came from and how to fix it. But a lot of diagnoses out there have what's called a disclaimer at the end. And you look it up and it says, say, fibromyalgia, and it says etiology unknown. And that means they don't know what caused it. Okay? So what we're doing with this functional pain, and I do it as well, but I don't focus on it as much because I don't prescribe a medication that makes people feel good right away. I make them do some work to actually fix the problem. Now, fibromyalgia is a symptom or an effect of a functional problem. So what that means is they're using the scale of 0 to 3. And so they're going to push on a spot, and how tender is that? 0 to 3. And they're going to do that multiple times, and so it's how high are you on the scale, and how many spots elicited a pain. Now most pain, so we got headaches, fatigue, IBS, endometriosis, back pain, neck pain, the things that I see, the joint pains, back pain, the headache, the neck, I'm going to use a scale of 1 to 10. And that's going to be more what they call visual analog scale. So you come in and I say, how are your headaches today? 0 to 10. And we're able to identify as we're getting people better, they're going from a 9 to a 7 to a 5 to a 4 to a 1.
Measurable.
It's measurable. So that's your subjective turned into an objective number. And that's how you know you're doing the right treatment. Okay. Symptoms are controlled physically and psychologically. So again, a lot of people will come in, and whether it's coming to me as a chiropractor or Coach Sean, I got pain, work it out for me. Or what do I do to work it out? Or give me an adjustment, or stretch me, or massage me. All of those things are the physical aspect. And I know I have had patients, and I'm sure you've had clients that, you know, it's like, hey, Mary, I will be glad to see you again and bill your insurance. But it just seems like this isn't going away. So what could it be? And then you find out, because I'm not a psychologist, but I try, it's a delicate conversation.
Right.
But, and we're here to say this, because we can say this to millions of people, you're not my patient or his client, but we want to do this service, and that is, when you have pain and you're treating it with somebody and it's not going away, it's usually not them, right? It's not the therapist. It's your body, your physiology, your stress. And so you have to identify that and take some ownership. You're going to feel much better if you do. And look at the psychological aspect. What is holding me up? Why am I harboring this pain? So that's a big one. And I hope you can understand the passion that I have for letting you know about that, because I think that's a huge part of this pain syndrome. And I feel, you know, we get kind of worn out working on people, and it's just not going away. So hopefully that helps you. Who are the people that you see? Well, you see people like, you know, Sean and I. You also see the physiotherapist, the psychologist, pain specialist, someone that can provide possibly a medication, whether it's the psychological, you know, something that's going to help with a calming of, you know, whatever you need. And I'm not, you know, saying that everybody needs this medication, but to identify if that's a component, maybe a combination therapy there. You know, I think there's ways to not do it from a medication standpoint, but if you're gone through the proper channels and you're still getting hang-ups, seek that professional. So at home, on your own, focus on the anti-inflammatory nutrition. There are some other things, I think, from a functional standpoint. Work with your physician, work with your trainers, work with your all the doctors, and they will give you some things that you can do. The home exercises, the home stretches, those are going to be in a specific order. You don't want to come out of the gate just going for it.
Yeah,
Okay.
Dealing with the intensity of the exercises, intensity of the stretches, get some professional help.
Yeah.
You know.
So, and it's, you know, I'm saying functional, and so it seems really simple. Well, this is a functional aspect, this is just how it's movement, I just need to stretch a little more. And functional pain, like we described, and hopefully I defined that well for you, and hopefully that helps.
And that, in a nutshell,
Yes.
are the 4 major categories of pain that we, the FitHealth pros, have hopefully given you plenty of information on. You know, physiologically, psychologically, there are a lot of different things that we touched upon within this video that you might not have thought about before. You might have thought about maybe at a less deep level than how we defined it today. hopefully we provided value for you. If we did, please smash that subscribe button, hit a like button.
Like us, share this.
You know, let anybody know that you know that could possibly benefit from these videos. This one's very specific, as were the last couple types of defining pain videos and this pain series. We also have a best health series that goes through the decades of life and how to best live a healthy life throughout those as well. So plus we have some one-offs here and there and some other series as well. So we're putting out a bunch of videos, a bunch of content that will hopefully catch your eye and help you. We're here to help.
Absolutely. So I am Dr. Kevin.
I'm Coach Sean.
And we are the FitHealth Pros. Thanks again for watching us. We appreciate it.
Yes, we do. Come along for more of the journey.
Yes. Be well. And these therapies are going to vary per type and specificity.
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 Yes. So say that 3 times.